Welcome. Thank you for taking the time to learn about living kidney donation at UChicago Medicine. Being a kidney donor is an important decision. Donating your kidney to someone in need can make a very positive change in that person's life, and the information here can help you make an informed decision. It is important that you understand all of the information regarding living kidney donor transplant, including the extensive evaluation process and the risks involved with donation. We want to make sure that you know what to expect, both short-term and long-term, so that you can make the best decision for you. The kidney works in many ways to keep you healthy. The kidney's main function is to filter out waste and excess water from your body. It also helps to keep your bones and tissues healthy and helps to control your blood pressure. When the kidney is damaged or not working properly due to disease, it leads to a buildup of waste and fluid, and a person may be in need of a kidney transplant. Patients who are in kidney failure often experience many negative symptoms, including nausea, vomiting, dietary changes, fatigue, swelling, shortness of breath, and high blood pressure. Once dialysis is needed, patients are either hooked up to a machine that cleans the blood and returns the blood to the body for 4 hours a day, 3 days per week, or overnight every night. Over 650,000 people in America have end-stage kidney disease, and over 110,000 are on the wait list for a kidney. The average wait time for a kidney from a deceased donor in Illinois is about 5 to 7 years. Sadly, about 8% of patients die while they are waiting. There are 4 types of kidney donors. Deceased donors come from a person who recently died and had a healthy kidney. Living donors can be someone that the recipient knows, such as a friend or family member. If the donor is a direct match with the person that they would like to donate to, once cleared by the transplant team, they can donate to that person directly. If the living donor is not a direct match, they have the option of participating in the paired exchange or swap program, which we will discuss more later on in this class. There are also donors known as non-directed donors who would like to donate to anyone in need of a transplant and sometimes choose to remain anonymous. It is important to know that you do not have to be a match in order to donate. In both deceased and living donor transplants, a successful transplant prevents complications associated with kidney failure and gives the recipient a new chance at life with a healthy kidney. The waiting time for a living donor kidney transplant is much shorter than waiting for a deceased donor transplant because once the donor is cleared and has agreed to donate, the surgery is planned and scheduled immediately. On average, living donor transplants work better and last longer than deceased donor transplants. The kidney recipient also has a longer life expectancy with a transplant compared to being on dialysis. The surgery is scheduled ahead of time, and it shortens the wait list for those patients who are not fortunate enough to have a living donor. Although the recipient has a living donor, we do not remove them from the deceased donor wait list until the transplant is completed. If for any reason we believe that the donor is at risk for kidney problems themselves, we will not allow them to move forward with the donation. If there is an unforeseen circumstance in the future where the donor does develop end-stage kidney disease and needs a transplant, they are given priority on the deceased donor list. While there is no medical benefit to the donor, living donation allows a family member or friend to greatly improve the life of their loved one. Many donors report a significant psychological benefit by having the ability to help someone in need. The donor team is a multidisciplinary team that is here to support you. Every potential living donor will meet with the team, which includes a kidney doctor, a kidney transplant surgeon, a donor advocate, social worker, pharmacist, dietitian, and nurse coordinator. Our team is a group of healthcare professionals who has been specially trained and experienced in transplantation, and we are here to help you with your decision and provide the best possible care before and after your surgery. If you decide to be a donor, we will be with you every step of the way. The number of people who need a transplant continues to grow, and living donation is the best way to save more lives. We will complete an extensive evaluation and testing to make sure that you fall within the criteria that is safe for donation. The donor evaluation begins when you are identified as a possible donor and continues throughout the surgery. Sometimes the testing shows the need for other tests. If a health condition is found that makes the health risk too high, the testing is stopped and you will be told about the condition. If approved for donation, we will coordinate surgery dates with you and the recipient's team. We will continue to follow you for 2 years after donation to monitor for any issues and to make sure that you are well. You can begin your evaluation once your intended recipient is placed on the transplant list. As a possible donor, you will have a very detailed evaluation to make sure that there are no medical, psychological, or social problems that would prevent you from being a donor. The kidney donor's medical expenses for both the evaluation and the surgery are covered by the recipient's insurance. Our financial coordinator will confirm this coverage prior to your initiation of evaluation. Donors will meet with the social worker to learn what costs to expect, as well as share information about ways to help with expenses that are not covered by the recipient's insurance. There is a possibility that living donors can have difficulty obtaining life insurance after donation, and there may be some financial burden related to costs associated with donation. Please do not hesitate to speak with your social worker to assist in this area. We are required to inform you that the sale or purchase of human organs is a federal crime. We will complete multiple medical tests to ensure your safety in regards to donation. This includes blood work to confirm that your blood type matches the recipient's blood type, and tests to confirm good liver and kidney function, overall health, and immunity to or lack of infectious diseases. We will check your urine to make sure that you have enough kidney function to last for the rest of your life. We will also assess whether you are at risk for any kidney disease yourself. We will complete an X-ray to check the health of your lungs and heart testing to check the health of your heart and its ability to undergo the stress of surgery and donation. We complete a CT scan to look at the anatomy, size, and blood supply of your kidneys to make sure that it is safe to remove it. Based on your results, additional testing may be required. There are 2 tests that are performed to see if you are a match with the person that you would like to donate to. The first test is a blood test that checks your blood type to see if it matches with your recipient. The second test is called a cross-match, which is a blood test that is completed in a specialized immunology lab. We take a sample of the donor's blood and a sample of the recipient's blood and see if it is likely that the recipient would have a reaction to the donor's kidney. A negative cross-match shows that there was no reaction and the donor can move forward with direct donation. A positive cross-match means that there was a reaction, and that donor may only move forward with paired exchange or a swap. A donor does not need to be a match to donate. If the living donor is a poor match for their chosen recipient, they can exchange organs with another donor-recipient pair to make a better match. So, for example, say that you want to donate to your daughter, but you're not a match, and someone else wants to donate to their best friend, but they're not a match. However, you may be a match for the other person's recipient, and they may match your daughter. In that way, you can swap kidneys so that both people receive a transplant. Sometimes swaps or paired exchange is done on a small scale like this example. Our transplant center is part of the National Kidney Registry, NKR. The NKR has hundreds of transplant centers across the country who participate and enter these incompatible pairs into their system. They have a specialized algorithm so that patients can find the best possible matches. Often this leads to large countrywide chains, which enables many patients to be transplanted. Both the donor and the recipient have their surgery at their home hospital, and the kidneys are shipped nationally to the appropriate centers. All donors are required to complete age-appropriate cancer screenings prior to donation. This is to ensure that you yourself are not at risk for cancer and that no cancer can be transferred via the kidney to the recipient. You should complete your cancer screenings through your primary care physician and send the results to us. These tests must be current at the time of your surgery. Once you have completed all necessary testing and consultations, your case will be discussed at a multidisciplinary team meeting. Here, all team members, including transplant doctors, surgeons, nurses, social worker, dietitian, and pharmacist, sit together and review your evaluation results. The team will make one of several decisions: approved for donation, further evaluation is needed, or not a candidate for donation. Your nurse coordinator will contact you with the team's decision. If you are not a candidate, your nurse coordinator will explain the reasoning behind the transplant team's decision. If further evaluation is needed, we will move forward with making arrangements to complete testing or consults that are needed. If you are approved, we will confirm the intended recipient's readiness for transplant and move forward with making plans for surgery. The donation timeline is based on your completion of necessary testing and how you wish to move forward. Not everyone who considers donation can or will donate. Our Living Donor Advocate team represents you to make sure whatever you decide remains private. As part of the process, we make sure that you do not feel pressured, coerced, or obligated to donate. This is a decision you need to make for yourself, and you have the right to change your mind at any time. Your reasons for doing so will remain confidential. Your team is completely separate from the recipient's team, and we are here to support you no matter what. None of your information will be shared with anyone outside of the transplant team, including the recipient, without specific written permission from you. You can feel free to share as much or as little as you would like with the recipient and your loved ones. If during your evaluation the discovery of a reportable condition are found, this information may need to be reported to appropriate health authorities, and there are items that UNOS, the governing body for transplant, requires to be reported for data purposes. About 1 to 2 weeks before your surgery, we will arrange for preoperative appointments. You will have some blood testing completed to confirm that there are no new issues or infections prior to surgery. You will meet with an anesthesiologist to make sure that it is safe for you to undergo anesthesia, and you will meet with your nurse coordinator and surgeon again to review the plan for the day of surgery, sign the surgery consent, and have any questions or concerns addressed. Living donation surgery is called a nephrectomy, which means removing your kidney. 99% of the time, this surgery is done laparoscopically. The surgeon will make 3 very small incisions which serve as a port for cameras and instruments to complete the surgery. A slightly larger incision will be made below the belly button to remove the donor kidney. Laparoscopic surgery is less invasive with a shorter recovery time, shorter hospital stay, smaller incisions, and less pain. The operation takes about 3 to 4 hours. With all surgeries, there are risks and possible complications. This is not a surgery that you need, so it is especially important that you understand the risks involved moving forward. Please be sure to review the risks carefully with your transplant team and make sure that you understand them prior to surgery. With any type of surgery, there is a risk of death. There is a 0.03% chance of dying from this surgery. After donation, you are at a slightly increased risk of developing high blood pressure or kidney disease compared to healthy non-donors. Living kidney donors live longer than average adults due to their exceptional health. The usual hospital stay for donation is 1 to 2 days. A full recovery takes about 6 to 8 weeks, but if your job does not require strenuous activity or heavy lifting, you can return to work as soon as 2 weeks after surgery. Aside from heavy lifting, there are no activity restrictions after you donate. Pain medicine is needed for a short time after surgery, but there are no long-term medications needed after donation. There are no dietary restrictions after donation. The transplant team will educate you and your support system on all of the things that you need to do to have a successful and speedy recovery. For your safety, the transplant team requires follow-up after you donate. About 1 to 2 weeks after donation, you will meet with your surgeon to make sure that you are healing and feeling well after surgery. At 6 months, 1 year, and 2 years after donation, we will check your blood and urine to make sure you are healthy and your kidney is working well. After 2 years, we strongly recommend that you follow up with your primary care doctor yearly and as needed in between. The transplant team is here to assist you in any way that is needed. Please do not hesitate to contact us with any questions or concerns. We look forward to speaking with you and helping you on this journey. Thank you for taking the time to learn about living donation and for choosing UChicago Medicine for your care.